Awesome. This is Tyler with Elation again. We are joined by Dr. Bacon. Dr. Bacon, how are you?
I'm doing good today. How are you?
Doing well. Thank you so much. If you could kind of tell us a little bit about, your Practice Fusion, Elation Health history, transition, and kind of all that occurred there. We have some providers on the webinar here that are, debating making a switch, debating if they should renew with Practice Fusion, and would love to kind of hear your thought process behind all that.
Sure, I'd be happy to. So I've actually been on Practice Fusion ever since I went into practice, which was in 2011, and started out really loving it because I was brand new to practice and I'd only done paper charting, and actually it was a great option. It was free, so it was perfect for a new doctor out in practice. And I did a residency, and we were not on Practice Fusion, and I don't remember what that software was called, but it was kind of cumbersome. And so when I went back, being on my own, I went back to Practice Fusion, and immediately was really ready for something different. And that was back, that would have been in 2012, I guess, 2013. And mainly, so at that point I was setting up my own practice and was finding that I needed to kind of piecemeal things together. Like Practice Fusion didn't have a faxing system, like a way to directly fax into the system. Their messaging system lacked a lot of functionality that I wanted. Their scheduling system lacked a lot of functionality. So there was a lot of pieces that I could do with Practice Fusion, but not in the way that I wanted to do them. A perfect example is that I wanted online scheduling. You can do online scheduling with Practice Fusion, but you can't, they have to request the visit, and then you have to approve it. So it was a lot more admin work than I really wanted to do. And I would say the biggest problem was really the faxing, because that's a huge administrative task, and a lot of that administration I was doing on my own. And so, but at that time I was working at a different clinic, though I was operating my own business outside of that clinic. I had to be within their systems, and they were using Practice Fusion. So they basically were like, you need to use Practice Fusion too, which made sense for this, the setup that was there. It was really what needed to be done, but it was not really, wasn't my favorite. And so made Practice Fusion work, basically figured out a way to integrate a fax system, figured out several other systems. And then in 2015, I went into practice on my own, opened up my own clinic with my husband. We partnered together and opened Elevate Health, where we are now. And I was like, I'm going to use a different charting software. I'm done with Practice Fusion. And really, with opening a new practice and the expense that had to go and invest in, most of the charting software out there are pretty expensive. Most of the EMRs are going to cost you some money to get what you really want. And with a lot of the investigation, I just decided I should just stick with Practice Fusion, and I should just make that work for the time being. So I did that, and at that point was able to create any of the systems that I wanted, and started creating quite a few different systems. The faxing we already had in place, figured out a new portal, figured out new charting, or a new scheduler. So basically we had like 5 different softwares to do all the things that we wanted to do. And It was great on one hand, because we could do everything we wanted to do, but nothing talked to each other. So it was tons of admin and tons of extra time basically managing the software just to be able to do the things that we wanted to have, the functionality. And about 8 months into practice, we decided to start a membership program, like a direct primary care. And when we did that, we needed even more systems. So Practice Fusion just became more and more unwieldy. But at the same time, it was working, and it was just me and my husband running things. And so we didn't really have the time and the space to change. It didn't really seem like the most appropriate thing to do. And so basically we had a system that probably cost almost as much as moving to maybe a more expensive EHR, because we were paying memberships for all of those different systems. and nothing talked to each other still. And so when we did hire admin, they were having to do a lot of importing from one place and exporting to another place. And so it was kind of like we made do, and, you know, I'd used it for so long, it worked, but I was never very happy with it. And then it got acquired and it became a paid service. And in addition, they started changing things, and not all the things that they changed were things that I loved.
Right.
And because then I was in a, you know, paying for that now, in addition to all these other services, you know, it seemed justifiable when I wasn't paying for it. So like, okay, well, it's a free service. It's okay that it's not that great.
Right.
And then we started hiring other doctors. So now it's not just me, there's other doctors here. And so then the cost of Practice Fusion went up. And I was still dissatisfied with a lot of the functionality. You know, nothing, I shouldn't say nothing. There's things that import directly into Practice Fusion, but not, the faxing is our main communication because we live in more of a rural area. So, you know, a lot of our labs and other systems here don't have the integrations with Practice Fusion that you might have in a larger city. So a lot of it, I would say, to boil down why we weren't super happy with it, was there was a lot of lacking functionality through the portal. Every time we asked the patient to sign up for the portal, they got confused. We couldn't use their scheduler. We like to have people fill out their forms online. They have the functionality, but we didn't have, it wasn't as, just nothing was as user friendly as we wanted it to be. And then the faxing. So they have a workaround for that. It's a separate system you have to pay for. Every doctor is another membership that you have to pay. So it ends up adding up.
Right.
The expense ends up adding up. And then the time, the administrative time, ends up being fairly cumbersome because you're having to import everything into the chart. And then the biggest thing that I didn't even realize that I disliked about Practice Fusion, I kind of understood it, but it wasn't until I started using Elation that I realized this, is that for everything you need to look at in the chart, you have to go to a different page.
Right.
And so I'd be sitting with the patient and I'd say, okay, well, there's some labs we ran 3 months ago, but let's go back and look at those. And I would have to dig in the chart to find it. I might as well have had a paper chart. I could have found it faster. And that was regularly really frustrating to me because I couldn't save time. I'd be sitting with a patient and you want that to be as smooth and quick as possible so that all your time is going to what's necessary, not sit around looking for something. And I felt like a lot of my time was wasted. So I felt like my administrative, you know, my front desk staff time was being wasted by having to import everything from one place to another. And then a lot of my time was being wasted having to look for things. And it just wasn't always, there's a lot of things that weren't very intuitive. It was also, you couldn't make a very easy notification to come up if you had a patient that came in. You know, for example, some of my patients are recovering alcoholics. I don't want to give them a tincture that has alcohol in it. And I'd like some way to know that. And Practice Fusion really didn't have an easy way to do that. And so it's little things like that that really add up when you're sitting there with the patient and really needing things to go quickly and smoothly. You know, I don't have any extra time. And so I want my time to be used as wisely as possible, both in the visit and out of the visit. And I feel like Practice Fusion wasted a lot of my time. That's kind of the, you know, what it came down to. So we hired a third doctor. And at that point we were like, okay, we've grown to a place we've really outgrown a lot of these systems. Because I was having to train all these doctors on, okay, the faxes come in through this system, and your new patient paperwork comes in through this system, and then this happens through this system. And it was so cumbersome. And it was fine when it was just me doing it, but once we had, you know, multiple front desk staff and multiple doctors, it became really clear that we had outgrown the system. And you know, I've been talking with Elation really for a couple of years. I had a lot of colleagues that had been using it and really happy with it. And every time I did research, at least within the naturopathic world, anybody that was using Elation was really happy. And so I was like, okay, well, I really need to look into this. And I was looking at several different EHRs, and Elation just stood out. And I actually had decided to go with a different EHR, and a lot of things came up once we were in the midst of getting that set up to where it was really clear it wasn't going to be a good fit. And we decided to bail before we put a lot more time and energy and money into that system, and decided, like, well, let's just take the leap with Elation. And, you know, at that point, I didn't really know if it was going to be a good fit or not, if it was going to work out. And we're really still in the early stages. I guess we have our graduation call today. So we're still very, yeah. Yeah. So I'll be talking to Bethany today. And anyway, since we started working with them, you know, it's not just me that needs to be happy on it. It really, and even more important, I think, is my front desk staff. And the fact that faxes come directly into the system and then are just matched to charts saves a lot of time. The messaging system is a lot more smooth. We work with Hint and Spruce, and all of that communicates with Elation, so that saved us a lot of time. And I'm sure there's a lot more functionality that we still have to learn about. I cannot believe how fast I'm able to chart. I can't believe how smooth it is. You know, when someone's sitting in my office, I still am going back and forth between Practice Fusion and Elation now because my charts haven't imported over yet. But when I have a patient that everything is in Elation, I can open up their lab, have their chart note open at the same time, have their past history, and I can see everything, which, as I had mentioned, that's something with Practice Fusion that I knew bothered me, but I didn't realize how much better it could be. And so that functionality it probably saves me the most time out of anything. I mean, I would say 2 weeks into using it, I had a new patient visit. I see about probably 1 to 2 new patients a day. And I finished that chart at the end of the visit. And that was the first time in my entire career that had ever happened.
Wow,
so I was like,
that's amazing.
All right. So, yeah, I mean, and I'm sure some of that comes from, you know, being more experienced now, but a lot of it came from the functionality and being able to see everything I needed to see and use everything. We've started inviting people to the Passport. I haven't had a single person that's had a hard time getting onto the Passport, and my patients are communicating with me really easily there. The staff has been incredibly helpful. You know, we've run into our glitches and our confusion and our problems and questions, and there's always been someone to answer the questions really quickly and timely. Yeah, and anything that we haven't understood we've been able to have someone explain to us and figure out how to use it. So I just feel like the functionality has been really impressive to me. And the time saving. Awesome. I mean, I feel like, well, we also, another thing that happened, so we bring on Elation and we lost the front desk person. She decided to go back and get her master's, which is awesome. We're super supportive of that. But then we were down to 1 front desk person, which is not enough for our practice. And I really do think the switch over to Elation has helped her. I mean, she did great. She was able to manage for the 3 weeks that we were without the staff that we needed. I feel like she really was able to manage in a way that I think would have been really hard with our previous system. So yeah, those are my main thoughts.
No, that's amazing. And I just was curious, a lot of providers are always worried about the learning curve of learning a new EMR. A lot of providers hate technology. I would just be curious how that was for you and the other 2 providers at your practice, what their thoughts were with learning Elation. Was it rather intuitive for them? You know, how quickly did they pick that up?
You know, I can say for myself, I picked it up very quickly. It was very intuitive. You know, I started using it and then I did a training, which I guess was a little backwards. But I was already like, oh yeah, I know how to do that. In fact, we ended up there was videos I was supposed to watch that I didn't ever end up watching because I had figured it out. And all of the articles that had been sent to me when I did have questions were so simple and straightforward and had great screenshots where if there was something I didn't understand, I was able to get the help to then understand it. So I feel like for me, within a week, I was fully charting on Elation with no problems, no needing. I would say the biggest hindrance was getting my templates up and going. And that was not out of difficulty with figuring out how to use Elation. It was out of just not having time to make templates. And so once I had those up, things went much smoother. I would say the other two doctors, the one doctor, she started using it pretty much immediately after me. And I would actually, this happened with both doctors. Both doctors, I thought, okay, well, I need to like sit down with them, make sure they're using it. And both times that I did that, I thought like, okay, I'm going to end up doing a little training session with them, and then we'll get them on with Bethany and they'll do a training session there. And both of them were like, I'm already using it. It's going great. So
awesome.
There wasn't a whole lot, I've sat down with, the one doctor has fully integrated it, and I haven't really had much that I've had to talk with her about. The other doctor had a list of like 4 questions that we went over last week. And I mean, all really basic stuff like, I'm looking for this provider. I searched this way. Is there another way? Oh yeah, here's how you search for it. That's another piece. I can't, in Practice Fusion, sending referrals, they always failed to go through. We always had this huge problem where we'd send the referral through the way that you could through Practice Fusion. It would fail to send. We'd find that out a day later. We actually stopped doing it because it happened so often. Then we'd have to print to our fax, and we'd have to send it again. It was this like multi-step process. I always had to ask my staff to do stuff. I just send my own referrals now, because why? It's going to take me just as much time to say, can you send this referral I just created, than to just hit a button for the referral to go through. So I feel like a lot of steps have been removed. That's really helpful. And I feel like I've seen that also in the other providers. They seem to be having the same experience from what I've talked to them. And the other thing that's really cool is they've also started making templates. Well, previously we all had our own templates. We were all doctors that had been in practice for quite a while when we came together, and they had their ways of doing things. I had my ways of doing things. And now there's all these templates in there. I've started looking at their templates and finding things that are in some cases better than what I'm doing. And in Practice Fusion, I didn't know where their templates were. I wouldn't even have known how to use their templates. So there's little surprises that keep happening, which has been really awesome.
No, that's awesome. And I really appreciate you taking the time just to kind of give us your experience with Elation. And like your practice, that's how Elation grows, is word of mouth. You've already put us in touch with other providers in your area, which we really appreciate.
Yeah.
So just want to thank you again for that.
Definitely. Yeah, I've been really happy with it, and feel like it's saving me time, feel like it's saving my staff time, which of course is then saving me money, which is also really great. And, I feel like I can't do the things I do without the crew that I have here. And if they're not happy and their lives are harder, then it doesn't do anybody any favors. And it doesn't,
Exactly.
I want them to have the tools they need to do the jobs that they need to do. And I feel like this has been there have been multiple times that I have had a meeting with or not even just a meeting, walked into the office manager's office, and she looked up at me and she said, I love Elation. And I said the same thing to her. And I promise you, we never said that about Practice Fusion.
That's awesome.
It's probably more like wringing our hands in the air going, Practice Fusion.
That's amazing to hear. No, that's exactly what we want.
Yeah.
Well, awesome, Dr. Bacon. We appreciate it. Thank you so much.
Yeah, you're welcome.